Okay, hi everybody. I'm here with Dr. Tedd Koren. Welcome back to All Things Chiropractic, a podcast series. Thank you, Dr. Koren, for being here for our second episode. So excited to have you.
Happy to be here.
Could you just tell us a little bit about yourself, who you are, so our listeners can get to know you a bit better?
Oh, sure. I went to Sherman College of Chiropractic in South Carolina. I graduated class valedictorian and editor of the school newspaper. I was a bit of an overachiever, I guess. And then went to Pennsylvania and co-founded the Pennsylvania College of Chiropractic and taught there for about 2 years. Then started a publishing company that became incredibly popular in the profession. And then fought the federal government because they were trying to close down natural health care. And we beat them. And
Yay.
6.5 year battle. Everybody said we couldn't beat the feds. We did. And then uh, I was in a bad accident and I couldn't walk more than a few feet at a time, couldn't use my hands. And I went to every chiropractor I knew. Nobody could help me. After this went on for 10 long years. A
Wow.
lot of pain, suffering. So between 40 and 50 doctors, most of them chiropractors, but osteopaths, physical therapists, MDs, acupuncture, et cetera, et cetera.
Hmm.
And one day I decided to take matters into my own hands. I had nowhere to go. It was 10 years I was deteriorating. And I combined a few concepts and ideas of techniques, chiropractic procedures, but nobody ever combined them. And I did, and I was able to work on myself using an instrument. I was better after 10 years of suffering, I was better in about 5 days.
Wow.
And however, my low back had disc problems. That took about 6 weeks. But that was after about 20 years of disc problems, no more disc problems. Um, and so it would have taken about 3 weeks, but I didn't know what I was doing. I was my first patient.
Hmm.
And that became what's known as Koren specific technique, which I teach. My second patient, apart from me, was my wife who had migraines for 12 years. And it took about 30 seconds to find what everybody else missed.
Mm.
And she never had a migraine again.
Wow.
So I started lecturing. I was always lecturing at state associations and colleges and organizations. And I usually make an announcement. Anybody have a problem that no one's been able to help them with, see me during the break.
Mm.
Then they'd have a bathroom break, coffee break, or a lunch break. And the line was people kept showing up. And I thought, oh my God, they're missing something. And it looks like with KST, which is what I call this procedure, Koren specific technique, we find what most everybody else misses, all
Mm.
kinds of doctors.
And that's
And it
amazing.
became very popular. I've taught over 5,000 doctors and
Wow.
healers. I let all kinds of healers come to the seminar because it it enhances whatever they do.
Mm.
And yeah, and I was in Mexico, Cancun a few and related areas a few times.
Yeah.
I toured all over the U.S. and Europe and Israel and Australia and New Zealand and even Taiwan. And I may
Amazing.
be coming back to Israel in about a month to speak to the Israeli Chiropractic Society, which is
Woohoo.
always a lot of fun.
That's awesome.
So,
Yeah.
and I still see patients out of my home.
Mm.
I do a lot of writing and lecturing and teaching,
Mm.
and I like doing that.
Mm. You've
So,
done you've done so much for
and
our
I
profession.
have a
Yeah.
garden, so all that fun stuff.
Yeah.
I'm sorry, what?
That's the best. No, I said you've done so much for our profession, and that's very obvious. And it just makes you a great candidate to come onto this podcast because we're all about bringing the magic of chiropractic back to the public and being able to articulate to them what is it that we really do? What is chiropractic all about? And so you couldn't be a better candidate for this podcast. And it's an honor to be able to speak to you and get to meet you. So thank you
Thank
so
you.
much. Thank you.
Thank you.
So
Thank you.
we had our first episode with Dr. Tim Schaub, and that was an awesome episode to talk about subluxation. So if you didn't watch that episode,
Yeah,
make sure you
Tim's
go
great.
back. Tim's awesome. We loved him. And he talked
Yeah.
about philosophically, what does subluxation mean? And with you, I'd love to share to our listeners the how of subluxation. So how can people recognize after watching our first episode and know knowing what the subluxation is, how can they better recognize in their day-to-day lives if they have subluxation, and then what can they do about it? So this is for anybody that maybe they've never seen a chiropractor before, don't even know what chiropractic is, and we want to give
Yeah, good
them
point.
these warning signs. And in one of Dr. Koren's amazing chiropractic magazines, which I recommend so much, Chiropractic Bring Out the Best in You. This is his third edition, and I love this one. I have this in my practice. And here we
Thank you.
have 15 warning signs. He's so expertly identifies for us specifically what are 15 things that you, as a normal person, could recognize that could indicate that you have a subluxation and need to be adjusted. So we'll go into the first one here.
Okay.
And I love this one because I think a lot of people experience this, but they just don't know exactly what it means. So if you could talk about your number one point is your heels wear out unevenly.
Oh, well, there are many ways of finding out if a person is unbalanced. Now, it's not just physical, not, I mean, structural like bones, but it's also nerves, muscles, joints, ligaments, brain function as well. If there's pressure on the nervous system anywhere, and it reflects, the body's like a hologram. Stress in one area can show up almost anywhere else.
Yep.
So one, it's one and I put down some obvious ones. Your heels wear out differently, and that's something your shoemaker would probably tell you right away. How come I have to get my heel fixed on one side and faster than the other? It's a sign that your body's unbalanced.
Hmm.
So that's a very easy and simple way
A hundred
to
percent.
know it.
A
Look at your
hundred
feet
percent.
if you
Right.
have heels.
100%.
Uh,
And someone might notice too with their heels wearing out more unevenly that they may have one leg or one foot shorter than the other, right? And that could also
Yeah,
be.
actually, the foot is it's not really shorter. It's the pelvis is off. The hips are a little bit off.
Mm-hmm.
When one side is off, the foot appears shorter.
Mm,
And that can be seen when you lay somebody down, either face down or face up, and you can see if the pelvis is, that's a sign that the pelvis is off. I think that's one of the reasons why chiropractic is so popular with pregnant women,
mm,
because it balances out the pelvis and it makes for a better delivery. There are many cases where women were supposed to have uh, C-sections or they had breech births, and a lot of times there's a breech birth because the pelvis is not open. And the baby, therefore, is constricted inside the womb. And when you open up the pelvis, you release stress on it. The baby can then move and assume the proper position for birth. So
100%.
we've saved, Dr. Chiropractor has saved God knows how many women from breech birth and from C-sections,
Right. And I
which is
think
nice.
100%. And that's so important. That's such a great point that you brought up. I think a lot of people have the misconception as well that our intention with chiropractic on pregnant women is to turn or move the baby. But as you said, actually, the focus is more on opening up the space in their pelvis, which allows the baby with
Uh-huh.
its innate intelligence to do its thing.
Oh yeah, we've had midwives and doulas come to our seminars also,
Oh, that's awesome.
and yeah. The whole idea is, and of course, women when they're pregnant, they can have pains and aches and sciatica and all kinds of problems, and partially because when you're pregnant, your body, the woman's body secretes excess relaxin, a hormone that loosens everything so
Mhm.
that the baby will have a lot of room. However, if the person has already a problem and things are distorted, that relaxin can actually make the distortion worse.
Mm,
And they feel horrible when they're pregnant.
mm.
And also, chiropractic can help women with all kinds of problems, all kinds of stress-related issues. I think pregnant women are benefit the most from chiropractic care.
That's so good to
And
hear.
but of course, babies, absolutely. There's a difficult birth can cause problems with the child, and there's a lot of ways of correcting even newborns. I've worked on newborns. They respond so beautifully. A lot of times they smile. So,
They just
but
know
oh
what's
yeah.
good for
So
them.
what we're really, oh yeah, they do. And what we're really doing deep down is we're releasing stress.
Hmm. So I
Oh,
think
did we pause for a second?
I just it just kind of glitched for a moment, but we're back. I can hear you and see you
Okay,
now.
yeah, I've been having a little trouble
No worries.
with this laptop of mine.
That's
Okay,
all right.
good.
Okay, so that's an awesome point. And another common misconception too, or at least I've heard in my limited time I've been practicing so far, is that people come in and they have recognized that their pelvis is imbalanced. They do feel their heel is worn out more on one side than the other. And they ask sometimes about a anatomical short leg. They believe that one of their legs actually just is shorter and that's just the way they are. Can you kind of
That's
explain?
rare.
Yeah,
Yeah, anatomical short legs do occur. I mean, could have had a broken bone or some, and they don't fuse properly, but that's really rare. Usually the pelvis is unbalanced.
right.
And you correct the pelvis and the person's now functioning without that stress. They're more balanced. They could run better.
Mm,
That's why we've had Olympic athletes and other runners as patients. They love the corrections and they feel it. Athletes are great because they're really in touch with their bodies. So
right.
they feel a slight difference.
Hmm.
I mean, a normal person may not notice it, but they're so fine-tuned. They
Sure.
know immediately that they're getting something really good.
Yep.
So yeah, they, but also the most people, one of the main things they feel after getting chiropractic adjustment is more energy.
Mm.
Of course, they might feel wasted and go to sleep, which is okay too. It
I was
means their
gonna say,
bodies
usually
were
after the
definitely
adjustment. Yeah.
overdone.
Right.
Yeah,
There,
sometimes some people and they need it. So,
absolutely.
but that's not unusual. Usually, the body works better. But however, the body's always trying to heal itself. And sometimes it doesn't happen all the time, but you'll correct a child who's been struggling with some issue, and they'll develop a fever, or throw up, or have diarrhea, which is exactly what they need to do, because we work with the body. The best doctor in the world is your own body, and when
100%.
it's working properly, it'll express symptoms. They're temporary, but it'll express symptoms so that you'll be fully healed.
Right.
And this is nothing new. It's been known for a long, long time that the best healing is done by the body. Fevers are a way of burning off infection and cleansing and detoxifying, which is
Yes.
is badly needed by,
Yes.
especially in this world. The all kinds of things, the vaccines, which are probably the number one cause of chronic illness in children and adults, and the not only vaccines, but the food, the glyphosate, the Roundup. In Mexico, you don't have
Hmm.
such a problem, I believe, and you're very lucky. We
We
have
yeah.
in
We take what
America.
we can get. Yeah.
Yeah, really. So you have
Yeah.
less vaccines and less
Hmm. Hmm.
pesticides,
Absolutely. And those are just
and that's a
more
very good
chemical
thing.
stresses. Yeah. Those chemical stresses
Oh my
are
God,
just
Americans are the sickest people in the world, and the children have the highest death rate
mm,
of babies in the modern world, the
mm,
first world, I guess you'd say.
mm,
Anyway, it's because of the toxins, the vaccines, etc. Some mothers, if they should not have dental work when they're pregnant because that can release mercury fillings, mercury, uh, mercury gases that go into their
mhm,
body and go into the baby. So
mm,
I always recommend, as much as possible, don't have dental work when you're pregnant.
mm. That's like
Very
another good
important.
tip. Yep.
Um,
Minimize the
yeah,
amount of
very.
chemical stress that we're going to be exposed to.
Oh, absolutely.
Yes.
Especially if they're put, and I think they stopped doing it in much of the world. There's still a little bit of America using a mercury fillings, silver fillings. They
Mm,
call it amalgam. It's really mercury and it's highly toxic. And so they probably don't do it as much as in Mexico.
hmm.
I know there's people that go to Mexico for holistic medical, dental care.
Hmm. Absolutely.
Mexico has much more freedom in healthcare than America does.
Right, right. Which is why we're trying to educate as well, still a little bit better on
Oh, of
how people can
course.
take advantage of the freedom that they do have, which of course we're all free to make our choices, but to make them educated, to know all of our options and be able to make informed choices for your family and for your children. And if you're
Oh,
pregnant, as you're mentioning. And I
absolutely.
think this is great tips for people to just, soak in and be able
Yeah.
to then go out and have a better life, right? All of that's going to add up to a better quality of life, which as chiropractors, I'm sure you agree is our mission for people.
That's a good thing. Yeah, and correcting the spine helps digestion and elimination. Elimination is very important. In fact, naturopaths often, that's the first question they'll ask a patient. How often do you go to the bathroom every day?
Hmm.
How many bowel movements? Very important.
Yes.
Elimination is absolutely essential, and chiropractic helps that, both digestion and elimination.
Yeah.
In fact, one of the predisposing problems in cancer is chronic constipation.
Mm.
Person is toxic. Auto-intoxication, it's called.
Mm.
So, yeah, it's important. And doing anything to improve elimination is really good for you.
Mm.
And
100%.
if a person doesn't have, anyone has chronic constipation, they better go to a chiropractor, get stuff checked out. It can cause long-term effects. I don't know what it's like in Mexico. I know in America we have a lot of iodine deficiencies, and that can cause
I've
chronic
seen,
constipation over the.
yep, I've seen plenty as well. Yeah, absolutely.
Yeah, a woman that don't
Hormonal
have enough
issues,
iodine.
thyroid
I'm
issues,
sorry,
thyroid issues,
thyroid,
hormonal issues. Yeah.
endometriosis,
Yes.
PCOS.
Hmm.
Uh, you know,
Very common issues.
uh, Oh my God. Breast cysts,
Mm.
ovarian cysts,
Mm.
breast cancer, all kinds of hormone problems, any kind of thyroid issue,
Hmm.
and constipation, all can be from low iodine.
Mm.
It's really fascinating, and most people don't know this. It used to be that our bread had iodine in it, all our breads. Then they took out the iodine that was used as a dough conditioner and
Uh-huh.
replaced with bromine, which is the worst thing in the world because it blocks iodine.
Ah.
And so, yeah, so it's very important that people do get iodine. I use a company that actually makes iodine for people,
Hmm.
very gentle and safe, called iodinesource.com. I don't get any money from it, but I
It's
have
good.
iodine here for my patients. I test everybody for
Ah.
iodine, iodinesource.com. It's really cool. There's a lot of good
Okay.
information.
That's
You
great
might like it too.
information. Thank you. I would love
Yeah,
it. I see people
yeah.
here all the time as well with the same issues as we spoke about. Could you also um running out of time. Oh, sorry. There we are. Could you also quickly go into, as well with the time we have left, a little bit about, besides supplementing with iodine, how chiropractic could help these women with these hormonal issues?
Oh my God, sure. Especially the upper spine, the atlas vertebra goes, if it's there's pressure on it of subluxation, can affect the brainstem and brain function. The thalamus, hypothalamus, pituitary, very, excuse me, very, very important. And so chiropractic care takes pressure off of the brain stem, which is which you need. Any woman well, everybody really should have a chiropractic checkup. That's just a general thing. As I like to write, you get your teeth checked, you get your blood pressure checked, you get your heart rate checked. Uh, what about getting your spine checked?
Hmm. And
And
your brain,
structural system.
right?
And your brain, absolutely. Well, D.D. Palmer, the founder of chiropractic, modern chiropractic, it's really ancient, goes back thousands of years. He said the three causes of body malfunction are toxins and structural stress subluxations, trauma, we'd call it, and let me see, thoughts, emotional stress.
Mm.
I think, those days in the Midwest where he was from, they didn't see much nutrition deficiencies.
Mm.
So, otherwise, I think he would have had iodine to that.
They had iodine in their
Um,
bread. It
so,
was good times.
I'm sorry.
They had iodine in their bread, so
Well,
it was better
although that
times.
he must have been aware of it because, that was the goiter belt in America, the Midwest,
Hmm.
around the Great Lakes. He was in Iowa, but that's a whole other area. We can get into that another time.
Absolutely, I would love to.
But
And
yeah,
so we have time for
yeah.
one more
So I
point.
have found that children are really good. They find that they did studies and found that IQ goes up when kids get chiropractic care,
That's
and they get
awesome.
along better with their peers. There's
Mm.
less stress on their brain and spinal cord. It's especially important today with kids have all these neurological problems.
Yep.
I don't know what it's like in Mexico, but in America
Yep.
it's pretty bad.
Yep.
Um, so yeah, chiropractic helps the body detox from the poisons that children developed. Some people get some children or get problems because the mother dumps her poisons into the unborn baby.
Mm.
In Chinese medicine, they say that measles is the body externalizing the toxins it got from the mother.
Mm.
And also throughout, I mean, they've always noticed when kids will go through an acute inflammatory response, fever, rashes, whatever, after it was over, they would have growth or mental spurts, in mental growth spurts or physical growth spurts, and it was part of the healing process.
Mm.
That's why the vaccines tend to people give fever reducers, Tylenol and aspirin. Usually it's not good. Kid needs
Right.
with a fever, kids needs an adjustment and let
Right.
the body do its thing.
Right. Well, with medicine, you're
Usually
just
when kids have
creating.
fever,
Yeah. Yeah, I think that's a great point. I think fever is such a good topic for us to talk about too, because it's such a great example of the innate intelligence of our body to literally become a
yeah,
stove top
absolutely.
and heat us up and have the
Well, the
energy move
medical
quicker.
model is to suppress symptoms.
Hmm.
And when you suppress symptoms, you drive disease deeper. And long-term suppression of symptoms causes chronic illness, which you
Mm.
never heal from.
Mm.
And it used to be that chronic illness, where you're always sick all the time and always taking something, was very, very rare. And today, with the vaccines and the Tylenol and the antibiotics and the other things given to kids, uh, over half of American kids now have a chronic illness, physical and mental.
We're constantly
So it's
suppressing
all
their
because of
symptoms and never going
you're
to the
suppressing the
cause.
symptoms and driving it deep.
Mm.
And the deepest, what's the deepest place a symptom can go to? It's the brain.
And brain, nervous system.
And if you looked at all the drugs given, if you look on they call it the physician's desk reference, which is just a list of side effects and what have you. They'll tell you that long-term use of drugs causes mental problems
Mm.
because ultimately the symptoms go deeper and deeper into the body,
So how
and the brain
effective
is the
is it?
deepest door.
How effective is it then for a kid with ADD, let's say attention deficit disorder, to be on an ADD medication in that case?
It's pretty bad. It's very bad. In fact, it could cause permanent problems for them. So I recommend, especially I mean, they did a study recently in America, and what they found out freaked out the MDs who did it, so they didn't release it. They didn't get it published for a couple of years
Mm-hmm.
because they were afraid of the powers that be. But it turned out that they had two groups of kids. One was vaccinated, one group wasn't. The vaccinated had something like 10% ADD. The non-vaccinated kids, zero ADD.
Wow.
And which implies what you have to do, get them under chiropractic care, and there's detoxification. I
Mm-hmm.
think detox will be the future of much health care.
Mm.
There's detox baths, there's detox substances, but your child has been poisoned
Mm.
and you want to get rid of the poison. That's
Right,
that's simple.
right.
And fever is a wonderful way of the body detoxing diarrhea, throwing up. I mean, perspiration and all
Mm-hmm.
that. Wonderful detox. And chiropractic helps your body work better.
Mm.
It's like I said, it's like good nutrition.
Mm-hmm.
What is good nutrition good for? Everything. So
Sure.
it's the same as good nutrition. It's good for no matter what disease or health problem you have, you need to have your body to be free from health damaging subluxations.
Absolutely. You said that
So
so
that's what I
beautifully.
write about.
Absolutely.
Thank you.
And we'll link what you write as well to be able to share so people can continue to read into this conversation because it's so good and you said that so well. Chiropractic is a integral part, we say, of natural health care, including nutrition and movements and thoughts and what we mentioned to begin to lower stress and become better connected human beings. And I love that you also quote from these studies too, because it's not just us saying it. It's a taboo subject, unfortunately. A lot of people tend to get offended when we talk about vaccines in children. But the fact of the matter is, and we'll link the studies that you talked about too in our video so people can go and if they feel so inclined, can continue to look into this because it's not just me saying this and it's not just you, Dr. Koren, who you're an expert in your field. You are obviously a very well-established chiropractor, and you've done so much for this profession. You are very well studied and knowledgeable, and there's so many more people and studies too that can also back up what you're saying. And I think that is a really important point for people to notice nowadays that the science is there,
Oh, it's
and
very important.
that has to
And
be louder than
actually,
the
every
fear
study
at
that
some
it's
point.
compared,
Yes,
I'm sorry.
the science has to be louder than the fear at one point so people can actually start
Oh, they freak
to
parents
understand.
out.
Yeah.
It's terrible. Fear can make people do the most horrible things.
The
And
most
the truth,
illogical things, things that don't make any
well,
sense.
I'm far more fearful of the shot than any mild childhood illness like measles, mumps, or chickenpox. I mean, I'm old enough to know that I had measles. Everybody in my class had measles. Usually what? Second or third grade. Everybody got it. It meant a few days off from school. That big
Hmm.
deal. And it was no problem. And that was normal and natural. And oh, by the way, we had no autism then also.
Right,
And nobody had allergies.
right,
And
right.
nobody had asthma.
The chronic
And in
illness
fact, it happened
rates.
in my family too. I
Yes.
saw it. I have my youngest brother suffered from asthma and allergies. And years later, I said, "Hey, David, how come you're the only one in the family that ever had measles, ever had allergies and asthma?" He said, "Well, it happened right after I got the measles shot."
Mm.
And he became an MD. Go figure, you know.
Wow.
Ah. But yeah, it happened right after. And this is not unusual, but the medical doctors are so brainwashed that they will often say it's a coincidence.
Mm.
It's a hell of a lot of coincidences going on,
100%.
but they're afraid to tell the
Okay.
truth. So the important thing is, for me, just tell patients the truth.
Mm.
And I
Amen.
say, every study comparing vaccinated to non-vaccinated kids showed the non-vaccinated kids are the healthier, far healthier. And it's the vaccinated kids with the asthma and the allergies and the autism and the ADD and all these other chronic problems, the ear infections and personality issues and
Mm.
weight
Thank you.
problems.
Yeah.
And yeah, that's why chiropractic families tend not to vaccinate. Chiropractors tend not to vaccinate their children. Uh,
And here. Perfect. Okay, so we talked a little bit about what the 15 warning signs of fixation. We didn't go through all 15, but I think that our conversation was so in depth and you so expertly articulated what people can look for, whether you're a child, whether you're a pregnant mom, whether you're just a regular adult or teen that's going through life with some of these stresses that we've talked about that are very common.
I'm sure you can go through all of them with your patients too,
A hundred
with
percent.
your Zoom call.
Yeah, we see them every
Yeah,
day, right? Those of us that practice, we see these issues every day, and we know as chiropractors, we know what we know, and we know that chiropractic can help, right? It's just as simple as that. So if anybody that's listening to this or watching this notices these signs or has heard something that resonates with them, please reach out to us and get adjusted. Please as well go into the information that we'll provide that Dr. Koren has so graciously
hmm
shared with us some of his writings and teachings and some articles as well that we talked about so that we just get the information out there and people know this is what chiropractic is really about. We're passionate about helping you to heal and heal naturally from within, empower you and to believe
absolutely.
that the power that made the body heals the body.
Yep, we have a lot more power than we realize.
Mm. Thank you. Thank you, Dr. Koren. It's been a pleasure chatting with you. You have taught us
Oh,
so,
my
so
pleasure.
much, so much. I'm so excited
Great.
for people to hear
Thank
this
you.
episode. Thank you.
Great. Let me know how it goes. What feedback do you get?
100%. Thank you. All right, I'll stop.